Alrighty, it's Friday again, and we are having way too much fun. Way more fun than we're supposed to have. Greg Raffetto, ex-Chippendale law graduate and former PPO entrepreneur, helping me out with some complex issues. Once again, welcome, Greg. How you doing?
I'm doing very well, Joey. Thanks for asking.
Fantastic. As we were talking earlier, you've done some good digging on a couple of these stories. We're going to first go spend a short amount of time on the healthcare battle. Actually, it's a war that's going on throughout this whole month and beyond until some real legislation is going to appear sometime next month. And then we'll get into the Rick Pitino sex scandal. So, first of all, Bob Beckel comes out this last Wednesday and predicts that the Democrats, he thinks, under the pressure of all these town halls and the polls which are showing that the health care plans that are on the table so far are not in favor. The Americans are not in favor at only 47% support or something like that, something less than 50. And so the Democrats are backtracking and trying to, and they don't have credibility. All these town halls are showing that. As soon as they try to say that the public option will remain a public option, the private option won't be taken away, everybody boos and jeers and doesn't believe them. So that's one main problem. So Beckel's thinking, well, what's one thing we can take away from the Republicans, because he's a Democratic strategist. He apparently has some kind of inside info that they're thinking about offering up tort reform. In other words, a limitation of awards in malpractice suits, which would be actually a huge concession, because Obama himself has said that he's not in favor of that, and it's not even been on the table so far. But as far as we know, where tort reform has been done, and it hasn't been done too many places, there's a few states, including California, which have at least on paper limited tort payouts to $250,000 based on an initiative that was passed back in 1974. I have a feeling there's ways that the lawyers can get around that to some extent, but I think it from articles I've read that is still one of the main reasons that California has such good quality doctors practicing here, is that the insurance companies have a way to calculate just how bad the malpractice damages could be from any one doctor. So I wonder if you could comment on, first, how much do you think in the overall system, the overall healthcare system, that the lack of tort reform helps to drive up costs? How much?
Well, it certainly drives up costs quite a bit, and tort reform is going to help the cost of overall health care, not just single payer. And it's something that Obama had previously said that he was against. He received the most cash from lawyers and law firms, more than $43 million, almost 3 times more than Hillary Clinton or John McCain received. But it looks like if he wants to pass his Obamacare plan, tort reform may have to be put up on the table.
Yeah, as Bob Beckel puts it, some trial lawyers may have to be thrown under the bus on this one.
It looks that way.
Well, that's the importance of this political pressure. As much as the Democrats have tried to characterize it as some kind of neo-Nazi fringe element that's out there, I think that the polls of just average Americans are showing that the popularity or the belief that Obamacare, as it's been written so far, is no longer in favor, and it keeps going down. So they're going to have to try to rescue it one way. And I really like this idea. I've always thought this was a huge driver of the cost to operate, a medical service. It was the malpractice insurance. Do you have any idea how much, let's say, an average doctor might pay for malpractice insurance? It's a pretty big number. Is it kind of depend on?
100,000 is not unheard of.
Really?
For OB-GYNs, they have to deliver babies, and anytime there's something wrong with a baby, they get sued.
So.
And the fact of the matter remains that no matter how much we know about medical care, some babies are still born with birth defects.
Yeah. The 100,000, is that the cost of a premium per year or something? Is that?
Yes.
That is incredible. So the doctor's salary, if he was paid a salary like by a hospital, might not even be 200,000 if he's just kind of an entry level or something. But he's got an automatic $100,000 that has to come out to pay his insurance. And you're just taking an example of an OB-GYN. It's probably different for different doctors.
That's correct.
But,
and that's presuming that there's even the insurance available to them for medical malpractice. There was an incident in the state of Virginia a number of years back where all the carriers had withdrawn from the state.
All the carriers?
So for OB-GYNs, yeah.
Wow, yeah, see, and that leads to doctor flight immediately, right?
Right.
They're going to take off from there. You're going to have to go to another state to